So this is renal failure by request from one of our Instagram followers. And I don't know how much detail that this person was actually looking for in renal failure. So I'm going to do a pretty comprehensive overview of renal failure. And this way, if you have any questions, you can just let me know directly. You can let me know directly via Instagram. You can let me know on this YouTube channel. You can email me. However you want to get in touch with me, let me know. But this is going to be a comprehensive overview and a lot of just kind of jogging your memory, because I'm sure it's something that you've gone over in class so far. And actually, before I want to begin, I just want to say sincerely, because I did make a post about this, that I am uber impressed with the interaction that's happening on our Instagram page, especially the thought that I can see that you are putting into your questions, answering the questions, to critical thinking scenarios, just your rationales. You really got it. And from one nurse to other nurses or to future nurses, it's really refreshing to see that happen. I'm a big advocate for nursing. I'm a huge nursing geek for sure. But I think it's a good thing. And this is a really important profession. So to see that type of desire and knowledge come through is very, very refreshing. Okay, so renal failure. When we're talking about renal failure, we are either talking about acute renal failure, so ARF, or we're talking about chronic renal failure, or CRF. And the differences between the two really kind of boil down to two things. So here's my acute renal failure, and this will be my chronic renal failure column. Acute renal failure, as we may or may not know, can be reversed. It can be reversed because acute renal failure is caused by something sudden. So it's a sudden onset. So if there was, for an example, a sudden drop in blood pressure, so that means that there's going to be a decreased amount of blood that's circulating to the kidneys. That can put somebody in acute renal failure, meaning that just for a short period of time, very quickly, there's been a decreased amount of activity happening on the kidneys level. That can be reversed. Versus chronic renal failure, it cannot be reversed. This is something that's long-term. So someone that's been suffering with diabetes over a long period of time, high blood pressure over a long period of time, this is kind of a continuous insult to the kidneys over many, many years. And this can cause renal failure. So those are the differences just between the two, so we're clear on that. Now, to further break down renal failure, we really have three categories that we can do. We have ourselves pre, we have intra, and we have post. Now, if we just look at these terms, from a medical terminology point of view, pre we know means before, right? Intra means within, and we know post means after. And what we're really talking about here is kidney failure that has happened before the kidneys, so before it's actually gotten to the kidneys. Kidney failure that's happened within the kidneys, so intrinsically it's happening within the kidney itself. And post, meaning that's happening after the kidneys. So if we were to look at that to see what that would look like, we can break it up kind of like this. So I'm going to make some rows, and then we'll get a better idea of how that really works. So this is going to be my pre row. This is going to be my intra row, and this is going to be my post. Let's make that P clear. Post row. So before we get into pre, intra, and post, let's make sure we're clear on anatomy, right? So I'm going to change this color. So these two things we're looking at, right? These are our kidneys, right? Our beans, my interpretation of kidneys anyway. Again, you probably know by now I'm definitely no Picasso. So these are our kidneys. These two large vessels that I've drawn here, this blue one is going to represent venous blood flow. So that means that this is a blood flow that's heading out of the kidneys back into circulation to the body. And then this red one is going to represent arterial blood flow. So this is the blood flow that's heading away from the heart to the kidneys. And that is very important in blood flow. If we're looking at these here, this is our ureters, right? So we have two, one emptying from each kidney, and those are emptying into our bladder, which I kindly put some urine in it so we know what we're looking at. Okay, so back to renal failure. So we're talking about pre-renal failure. Pre means before. We've already established that. So that means that there's been a disruption or there's been some kind of dysfunction in blood flow to the kidney that's causing the kidney to fail. And so what I mean by that, we're really talking about this target vessel right here, the artery. So that means there's been a disruption in arterial blood flow to the kidneys. There's two things that we need to keep in mind. The arteries feed blood to the kidneys to be filtered. That way the kidneys can filter out the waste. Whatever is waste is going to get excreted out, right? Whatever is good, and I kind of air quote good, whatever's good is going to get sent back into circulation. So the kidney's jobs are to filter, right? That's what they need. In addition to that, our arteries feed blood to the kidney for kidney survival itself. All of our organs and our tissues need to have blood flow in order to survive, because we know with blood flow comes oxygen. Without that, we will have tissue death or organ death. So an example of pre-renal failure, we're talking about lack of or decreased blood flow to the kidneys, okay? And that can be a result of shock. Now by shock, we're talking about hypovolemic shock, so we're actually losing the amount of blood volume that's going to the kidneys. This can, also mean that there has been some kind of traumatic event. This can mean that there is low blood pressure. Now, low blood pressure means that, again, we're having a decreased amount of blood flow that is going to the kidneys. Decreased amount of blood flow means that there's going to be a decreased amount of activity happening at the kidneys. There's going to be a decreased amount of function, and that can lead to renal failure, okay? Now, intra, we're talking about here, and I'll make an arrow here. We're talking about within the kidney itself. Now, things that can lead to kidney failure within the kidney can be direct trauma. So there's actually been trauma directly to the kidney. It can be as a result of medications, or I'll make a little dash here, drugs. Now, we've learned that some antibiotics that we prescribe to patients, we need to be cognizant about it because they are nephrotoxic. Some medications and drugs are nephrotoxic, meaning that they can damage the kidney at that level. So perfect example are some of our mycins. Our mycins are nephrotoxic. If we're not careful in patient education and how we administer that medication, we can cause damage to the kidneys. Another example of this would be like a glomerulonephritis. Let's make sure I spell that right. Glomerulonephritis. And we know that glomerulonephritis is inflammation of our glomerules. And those are our small tubules that do the filtering of the blood, right? So if something goes wrong inside of the kidneys, whether it was a direct trauma, whether we ingested a medication or a drug that's damaged the kidneys, or we have an infection that's causing inflammation to our filtering tubes, that is going to stop the function of the kidney. Therefore, we have failure, right? Now, post-renal failure, we're talking about anything that's happening here at the bladder or in the ureters, because the ureters are in fact still after the kidney. So an example of that, we can be talking about kidney stones, right? Let's see, if we have some kind of clot, if we have BPH, those are good examples. Now I'll tell you how that happens. Let's come over here and I'm going to draw a picture. So let's imagine for a second that, and let's make it green. If we have a kidney stone, and let's say it's a large enough stone, and it's blocking our ureters at this point, well, what's going to happen? Now I have an obstruction, right? Because where I should have urine emptying the kidney and traveling down to the ureters has stopped at this point. And I'm going to end up with a buildup of urine that's going to reflux or shoot back into the kidney. We know that over time, if we're having a constant reflux of urine that's going back into the kidney, that can actually cause scarring, that can cause damage, and that can impede the function of the kidney. That will put us in renal failure. This is a post-renal failure issue because the problem is here. The problem is this kidney stone that's trapped in the ureters that's causing the urine to build back up and travel back up toward the kidneys. Now, same thing if we're talking about BPH. That's the same kind of theory. If a male is suffering from benign prostatic hypertrophy, meaning their prostate gland is enlarged and it's squeezing their urethra, then the urine that should be emptying here is not emptying because the urethral opening has become very narrowed. So what's going to happen? Well, that urine is just going to build up, right? We're going to have a buildup of urine, and it's going to continue to build up and build up until eventually, well, you guessed it, it's going to travel back up through the ureters, and we're going to end up with an actual reflux. So it's going to get back up to the kidneys, and we know that urine that comes back to the kidneys is going to cause damage and scarring, and it can cause the kidney to fail. And that's the same idea with the blood clot as well. Okay, so now that we have an idea, a better understanding rather, I hope, of renal failure, meaning acute renal failure, chronic renal failure, and how we categorize that, we'll talk a little bit about the treatment. So we have to really treat, like many things, I said it before, the underlying cause. So correcting or reversing the issue if it's possible. So for instance, in pre-renal failure, if we're talking about a decreased amount of blood flow, a decreased amount of volume that's heading towards the kidneys, then our treatment would be guided towards that. So replacing the blood that's lost, replacing the fluid that's lost. So this would be like our fluid or our blood replacement or resuscitation. That way, if we can put more on board, then we can help it get to the kidneys to restore the function. And keep in mind, with the increased blood and fluid that you're putting on board, you have to give medication to increase the actual delivery to the kidneys. Now, as far as intrarenal failure goes, if we're talking about that, if it's a direct injury to the kidney itself, a direct physical injury to the kidney that's actually caused damage, then it would be correcting that. Is it such a severe injury to the kidney that it needs to be replaced? Is it something that we can therapeutically regimen? As far as a medication or a drug that we have ingested that's caused damage to the kidney, a reversal agent. So giving a reversal agent for that, or giving some type of binding agent to get it out of the system. And of course, fluids to flush and help clear out. Glomerulonephritis, well, if it was caused by, let's say, a bacteria, or our big culprit for causing glomerulonephritis would be our streptococcus, then antibiotics, of course, for that. Again, if it is such severe damage to the kidney, do we need to think about other therapeutic regimens to help correct the issue? And then if we're talking about things post-renal failure, like our kidney stones, our clots, BPH, and I should add on to that, if somebody has some kind of muscular disorder as well and they have a hard time emptying their bladder, that can actually cause post-renal failure over time. So kind of back to treatment, kidney stones. Well, then we're thinking about our kidney stones treatment, right? Trying to break up that stone and pass it. Clot, break up that clot and pass it. If we're talking about a patient that has BPH, then we're going to be actually treating the BPH to correct the issue of this buildup of urine, and that's going to be refluxing back to the kidneys. Now, treatment as far as acute and chronic sometimes can cross lines and be the same. So our treatments a lot of times are going to end up being, I shouldn't say a lot of times, should definitely depend on the severity, but the treatment that we're most familiar with would be a dialysis, right? Now, somebody can be on dialysis that has acute renal failure, and someone can be on dialysis that has chronic renal failure. The difference is going to be the period of time that they're on dialysis. And we know dialysis's job is to filter the blood and filter the waste and send back good things, just like the kidney would do. So dialysis is really a process of, and let me write hemodialysis, because that's what I'm referring to. Our hemodialysis is a process of filtering the blood, removing the waste, and sending back the good blood to the body. That's what the kidney is going to do. So in the absence of kidney function, we're going to rely on hemodialysis. Of course, it's also peritoneal dialysis, and that would be through our abdominal peritoneal area. So this is renal failure in a nutshell. So we have discussed acute renal failure, chronic, the differences between the two, and we've categorized renal failure by pre, intra, and post. Now, if you understand that, if you understand at what level the kidney failure has actually occurred, what was the mechanism that caused the actual dysfunction, then you can clearly start to think and analyze about how to treat it, how to correct it, and some of the manifestations that you're going to see. So if we're thinking about what the kidney's function is, let's use that as an example. We know the kidney's function is to filter out the blood, right? Filter blood. We create urine because the urine is actually the waste product of what the kidneys filter and sends back the good stuff, right? Blood is not just blood alone. Blood is actually other products, right? We're talking about our phosphates, and we're talking about our electrolytes, and we're talking about our nutrients. That also makes up our blood volume. We're talking about fluid. Someone that's in kidney failure, we know, is not making urine because the kidneys don't work. Kidneys don't work, urine's not made. Fluid, blood, all that stuff isn't going anywhere. It's going to build up in the body. So the manifestations that you're going to see, and let's make this in a different color so we can see. So let's just write our manifestations. Manifestations. Because of what we just discussed. We know we're going to have increased fluid or volume on board because it's not getting filtered and not going anywhere. So what do we see with increased fluid and volume? And you know this, edema, right? We're going to see edema in the patient. We're going to have to look out for what's going to happen as a result of all this extra fluid happening. Is it coming back to our lungs? Is it going to cause extra stress on our heart? What's happening? We're going to see decreased urine. We're not making any. So oliguria, we might see an absence of urine as well. Now, what's important about that is if the kidneys stop filtering, right? We have bigger issues than just the fact that we're not losing volume that we should be getting off board and that we're not making urine, but what things in our body are going to build up. So the things that we're going to see, and let's bubble that because this is important to know, what's going to increase in our body as a result? Well, we know that we're going to have an increase. Let's make this bigger so we can see. Much bigger. Okay, so we're going to have an increase in potassium. We see our increase in our phosphates. We see a decrease in our calcium. And our patients can actually become anemic, right? Which we know was low blood. These are really important to know and to keep in mind in renal failure because as you know electrolytes, you know that with an increase in potassium, what's going to happen to this patient? What are they at risk for? I know a lot of you are probably thinking about cardiac issues, and you'd be right about that. An increase in phosphates, same thing. Think about, well, we know this is going to happen because the kidney's not filtering this out. What is the client at risk for? Decrease in calcium. Always thinking about how does that relate to my client and what are they at risk for happening? Think about our bones in this case. The potassium is always a good one to keep in mind. I see this come up very often in NCLEX style questions about, keeping a patient on a low potassium diet who is in renal failure because they have a buildup of it in their body. That's the type of question that you might get on that. Now, we're anemic. Make sure that you remember that as well. That's a really common side effect or, adverse event that's going to occur in someone that has renal failure. Our kidneys produce erythropoietin, and erythropoietin is actually going to stimulate the bone marrow to make blood, right? So I'm going to just put these little red things here so we know blood. We're thinking about blood. When our kidneys fail, they don't make that erythropoietin anymore. Whoop, now we're going to cross it out. As a result, that stimulation to the bone marrow to make red blood cells isn't there. It's lost. And then the patient's going to become anemic as a result. Okay? So I would say this is our kidney failure in a nutshell. Again, go over it again. You can always watch a video as much as you need to. And if you have specific questions, let me know, and I'd be more than happy to get into real detail about certain things if that's what you're looking for. So again, let's kind of recap. Acute renal failure versus chronic renal failure, and our detailed descriptors of each. So pre, intra, post. How does that happen? What are some examples of that? How do we treat them? The manifestations that we're going to see. Just think overall, kidneys are failing. We know that we're not letting off any fluid at all. No volume is being lost because our kidneys shut down. So it's building back up. Edema, increased fluid volume is a huge thing. When we're not filtering, that means that all of our blood and the components that travel in our blood aren't going anywhere. They're going to build up, or they're going to be broken down abnormally. And the big ones, potassium, phosphate, calcium, we have to think about, and anemia that we're going to see. And then, of course, our hemodialysis as an option, meaning when our kidneys don't work, we need to think about, well, what do we need to have to do the function of our kidneys? So, any questions, you know how to reach me. Again, on Instagram at TOOTRN, TOOTRN. You can reach me via email, which is on my website, and that is www.tootrn.com. Otherwise, I will see you back on social media. Have a good night.